Good afternoon. My name is Olutayo Sogunro, and I am a physician. I am a general surgeon. So now I'm going to answer a few questions that I kind of came up with that I think might be helpful for those that are in the audience. Here goes. So, what kind of physician are you, and what type of training did that involve? So, I am a general surgeon. After college, grad school, medical school for 4 years, I trained for 5 years in a surgery residency program in Toledo, Ohio. After medical school, for the most part, you have to do a residency program, and they minimum are about 3 years. The ones that are 3 years generally are internal medicine, family medicine, pediatrics. OBGYN is 4 years, and pretty much all the surgical specialties are 5 years or more, including orthopedic surgery, general surgery. Neurosurgery is usually 6 years or more. So just know it's a time commitment after medical school as well to really be able to train and be that specialty. The field of general surgery involves the gastrointestinal system, basically everything between your mouth and your butt that I tell my patients. I also do surgery on breasts, inguinal surgery, skin surgery. So basically, if you need your gallbladder taken out, your appendix taken out, your any issues with your stomach or your small or large intestines, I'm your girl. I also can do a mastectomy if you have breast cancer or breast abnormalities. I can fix your inguinal and abdominal hernias. I could do your colonoscopy or your upper endoscopy. So really between your mouth and your butt, right? Next question. What do you do on a regular day? So currently, I am working as an acute care and trauma surgeon in Bridgeport, Connecticut, where I do a lot of the things I mentioned above, but more on an emergent basis. So I do emergency general surgery. That's what the acute care part means. So basically, if you come to the emergency department with your appendix that's burst or ruptured, I'm your girl. The ER physician will call me and I'll take you to the operating room that day. If you come in because you were in a bad car accident, you were shot multiple times, you got stabbed, I'm also your girl. That's a trauma part of what I do. So half of what I do is the emergency general surgery part, and then the other half is the trauma part. So, if you have multiple gunshot wounds, you're bleeding out, things like that, I would be the one to take care of you and operate on you. What are tips I have for an undergrad trying to get into medical school? So I have a list of them here. Do well academically, get a good GPA. That's kind of basic, right? Nothing more on that. Develop good study habits, figure out what works for you and stick to it. Get involved in campus clubs and activities, and really widen your horizons, right? Don't necessarily be like, hey, they just have to be medical. No, they don't. You will learn from a lot of other experiences too, because being a physician is about being well-rounded and communicating with people, and you learn how to communicate with people by having different experiences that you can share with people, right? So I think that's important to broaden your horizons. You can participate in free clinics, volunteer there. You can, if you have the opportunity to, participate in medical mission trips, volunteer at health fairs or community centers, um, do research. Remember, physicians are scientists first. Don't forget that. So you can do basic science or bench research as an undergrad like I did. Or if you get involved with shadowing early, you can do clinical research with a physician or a hospital. You can even write up a case report or a cool disease that you saw with the physician that you saw it with. Just ask them to be your faculty physician on the case, and I'm sure they would love to. Um, I recommend getting started early on this part because research, is not an overnight thing. It takes time. So you don't want to try and cram it into a certain period of time because you have regular coursework too, right? You are a student. So you just want to make sure that you time manage well, okay? Study for the MCAT. If you plan on going straight through, kind of doing the traditional route where you graduate college and then go to medical school, then you want to take the MCAT during your junior year and plan to take it like that summer between your junior and senior year by the latest, okay? This way you will get your results and can apply to medical schools to be enrolled the year that you graduate. Don't shy away from learning cool and different things. Like I said, you want to be a well-rounded physician, so get involved in cool things, anything that you do, you can share with your interviewers, right? Everyone, you know, is a good student and has a good GPA, right? That's applying to medical school for the most part. So what's different about you? So don't be afraid to stand out, right? What are some key points that I want you to take from this Throwback Thursday interview? All right, so here I am wrapping up, okay? So here are my key points. Number one, work hard. Honestly, success is not easy. It is not given to you, it is earned. So just work hard. That's for anything in life. You got to work hard. Make a plan and write it down. Honestly, a failure to plan is a plan to fail. I've always been told this. So, when you write it down, you kind of have a roadmap for yourself, even though you may veer off of it a little bit because, hey, life happens, right? But you can always look back at your map to get direction of where you're going. Be yourself and be authentic. Whether it's in an interview for med school, an interview for a job, a encounter with a patient, people are pretty good judges of character and they can see if you're not being genuine. So be you, be genuine, be good. I don't know how else to say that, but just be good. Um, Make sure you choose medicine because it's what you cannot live without. It's what you feel you are meant to do. So just remember that this is something that is going to be kind of lifelong for you. Don't go into it because you think it's cool, because you think it's flashy. Go into it because it's what you feel that you are meant to do, because you will be asked to do things that you've never been asked to do before. And guess what? You get up and do it. And that's what being a physician is about. That's what being a healthcare worker is about. And I wouldn't have it any other way. So just make sure that it's what you really want to do. Okay. Um, Practice self care. Don't forget to take care of yourself. This is a topic that comes up a lot and is a hot topic in healthcare. But that aside, I've always believed that you must take care of yourself in order to be able to take care of others. Find the thing that relaxes you, that balances you, that gives you joy, and make sure you incorporate it. Remember, if you don't take care of yourself, you can't take care of others. Whether that's exercise, whether that's going to the gym, spa, aromatherapy and candles, what I love, vacation, seeing your family, whatever it is, incorporate it into your routines. So with that said, I hope that this video helps some people out there. I hope you enjoyed it. And that's it. So